The Southern Tier AIDS Program, or STAP, was founded in 1984 to provide services to HIV-positive individuals living in the 8 counties in the Southern Tier. And one of the services they offer is syringe or needle exchanges for users of intravenous drugs at their 2 prevention point centers. And here to talk about those centers and the Southern Tier AIDS Program's needle exchange is the Southern Tier AIDS Program's Executive Director, John Berry. John, thanks for coming by.
Thank you for the invitation, Samuel.
So just to get us started, can you explain for us what a needle exchange actually is?
A needle exchange is first and foremost a public health intervention to stop disease transmission. And I should note that it's one that's been incredibly successful. And we have the research and the data now over the course of the last 20 to 30 years to prove how successful it's been. In New York State, in the early 80s, when HIV was first beginning to spread, about 45 to 50% of new infections were due to people sharing needles. That number now is down to about 3 to 4% of new HIV infections. So we have some pretty good evidence that as a public health intervention, it prevents disease transmission pretty effectively. And not only that, but certainly saves all of us as taxpayers and citizens a whole lot of money.
And can we maybe talk a little bit about where the idea for this kind of needle exchange even came about in the first place? Was this kind of with the growing awareness of AIDS as a disease?
Underground needle exchanges, have been present for a long time, even in the late 60s and through the 70s in larger urban areas. But they really started to blow up, again, when HIV came on the scene and people became aware that, if they didn't want to acquire this disease, they were not going to share equipment with other people. So they quickly blossomed from underground endeavors in the 80s and gradually health departments in some states, such as New York, in the late 90s began to actually fund organizations to provide the service. There were some changes in the law that allowed that to happen.
Mm-hmm. So when did the Southern Tier AIDS Program's needle exchanges actually first open their doors?
We have 2 storefronts that we operate. We call them fixed sites. The one here in Ithaca began in 2002, so it's been, 12 years now? The world, in fact, has not ended. We started another one in Johnson City, which is down in Broome County in 2008, so that's been up and running for about 6 years. And we are certainly looking at moving into other counties, within the 8 that we cover, because the need is certainly there, unfortunately. Not so much for HIV anymore, but what we're seeing is hepatitis C is really spreading rapidly. And we're getting a lot of calls from, rural health departments saying, oh my God, we've tested and we've got, 30 people who are hepatitis C positive, and they all, surprise, surprise, they all know each other, and they're identifying that they've used injection drugs together.
So how does the process actually work? Say you go into one of these 2 fixed sites where the Southern Tier AIDS Program offers this needle exchange. What's that experience actually like?
Well, everybody that comes in, we do a quick kind of assessment or evaluation of the person and what their needs are. The services are anonymous, so we give people a card that has a code on it, and we ask them to use that code when they come in because we have our own set of data to track and report back to New York State. And we kind of, this is going to sound, hackneyed and cliched, but we, meet the person where they're at. We actually do a lot of referral to treatment if people are ready for that, if they've had enough. We work with people on injecting safely because there are a lot of things, diseases and a lot of difficulties you can get into other than just HIV and hepatitis C. And I'll give you one example. There's a lot of bacteria that runs around on the top of your skin that doesn't make your life very happy if it's inside your body. And you can get heart infections. People can get things like abscesses. So, we do basic education with people on, if you're going to inject, here's the way to do that safely. We are what's known as a harm reduction program. So, again, we are always encouraging people to use less if they can, to work toward controlling their use, and to work toward treatment if that's possible for them.
And that final point is something I do want to talk about a little bit more, because that's where I can imagine a lot of the questions have come up about the kind of services that a needle exchange offers. Someone could come in and say, well, if you're providing people with clean needles, aren't you just essentially enabling their drug use? So I'm curious what the Southern Tier AIDS program's response to that kind of accusation would be.
Well, our response is always first and foremost, this is a public health intervention. And again, I refer people back to the numbers as far as the rates of HIV transmission among injection drug users. That's just objectively a good thing. That there are many people out there now who, yes, they engaged in this behavior, but that's not a reason that they should acquire a deadly disease, and it's not a reason that they should die. So first and foremost, it's a public health intervention. But beyond that, I don't think anybody, sets out to say, I want to become addicted. So I think that we offer hope to people. I think that we offer people a way out. And I don't think that the presence of needles causes someone to use heroin any more than the presence of a condom causes someone to run out and have sex. And as a matter of fact, if you'd like to, you can go out to your local pharmacy tonight, and if you have $2.50 to $3 in your pocket, you can buy 10 syringes. That is completely legal in New York State, has been for well over a decade. So, commence.
So thinking about, that is, what a potential kind of response to what you're doing could be. What has the community's reaction been to the fact that these services are offered both in Tompkins and Broome counties?
I think in both counties, before we ever opened the syringe exchange programs, there was a lot of discussion. There were a lot of meetings held with public health officials, law enforcement, elected officials, people in drug and alcohol treatment, people in mental health, community members, to let people know what we were doing. We didn't just materialize out of thin air one day, throw open the doors and say, we're going to start giving out syringes in your community. In both those communities, the community itself bought into the idea. We presented them with, the reasons why we would want to do this, and it was accepted by, maybe if not everyone in the community, a large portion of the community understood why this would be a good idea.
And were there any kind of legal challenges to actually opening up these centers and offering these services? I'm assuming this is legal if the Southern Tier AIDS program is doing it, but has it always been that way?
It has not always been legal, and the law has been evolving over the years. Again, one of the challenges that we always faced was that in some communities, law enforcement, not Ithaca, by the way, I just want to make that perfectly clear, but in some communities, law enforcement would, kind of camp out outside syringe exchange programs and, kind of trail people and try to arrest them for possession of drugs and those things. People would do things like, somebody would have a syringe on them and there would be some drug residue in it and they would charge them with that as a crime. It's a 7th degree misdemeanor, I believe. That's no longer a crime in New York State, by the way, because Governor Patterson changed that. So there's been a long, slow evolution as the programs have run into problems, and we've seen where the barriers are for people accessing the programs. We've gone to Albany, talked to our legislators. We've been advocates, and tried to change things.
Mm-hmm. And if we can maybe move on to the kind of impact that these centers have on the community. In terms of numbers of people that have come through in the year or maybe since these centers opened in 2002, how many people do you see? How many needles or syringes do you exchange in a given period of time?
Well, since both of the programs, since they have opened, have served well over 3,000 people. But as you can imagine, some people come into the program and get out of it very quickly. Other people we serve for a longer period of time. In any given month, we probably serve in the neighborhood of 400 people. Probably do a little bit over 900 to 1,000 actual exchanges. And in any given year, probably 500,000 to 600,000 syringes actually go out the door. The good news is, out of those 600,000 syringes, those are not all out there bouncing around on the streets. One of the things that we stress with people is you really need to bring these back. That's a big part of the program. And we have about a 90% return rate. And one of the reasons that is important is, because this is done for the good of the community. We don't want the people collecting the trash to get stuck with a used needle. That's not pleasant for anyone. We don't want law enforcement, when they're patting somebody down, to get stuck with a used needle. And again, that's one of the things that we always tell folks in the program. It's like, if you are stopped by law enforcement, here's what you do. Tell them you're in the program. If you have something on you, tell them immediately. Do not let somebody pat you down and get stuck. That's not good for anybody. Totally defeats the purpose of what we're here to do.
And thinking about those kind of hard numbers, what would you say the impact has been in the communities around where these exchanges are available? So maybe Johnson City and Ithaca. Have you seen a real impact of having these two sites in those more kind of focused areas?
Yes. The impacts that we see are, we facilitate people getting into treatment on a monthly basis. Probably about 5 to 10 participants will go into treatment and make an attempt. There's also some good research that proves that people who are syringe exchange participants and have kind of gone into treatment on their own time schedule are more likely to complete treatment. So that's a good outcome. I think the other outcome is we've been doing some research the last several years. We've been doing surveys in different counties, and we've been testing people for hepatitis C. And while we've been coming up with rates that I think are higher than we like, i.e. 30, 40, 50%, those rates are significantly below what you will find in more urban areas, where if you do the same process, you'll come up with 80% of the folks have hep C. So that's kind of the next frontier that we're moving on to. I think that we've done an exemplary job preventing HIV infections. Now it's time to do the same thing with hepatitis C.
And that future is something that I'm also interested in. You mentioned the focus on hepatitis C and maybe moving away from HIV. But what would you personally like to see for these needle exchanges moving forward?
Well, as many of your listeners may know, I don't think it's a mystery to anybody or a secret that the use of prescription and opiates and heroin is a tremendous problem in upstate New York, rural New York. So I think in all of the 8 counties that we serve, we are getting calls from, usually health departments telling us, we need this service locally. We have a heroin problem. We have a hepatitis C problem. I'm not going to sit here and tell you that I think this is the solution, but I know that it's part of the solution. I know that just law enforcement is not stopping this train. I know that just treatment is not stopping this train. So we're going to need to find some other avenues and some other approaches in addition to those to slow this down.
And John, if people want to find out more about the needle exchanges or say anything else that the Southern Tier AIDS program does, where can they find that information?
Well, they can go to our website, of course. That's www.stapinc.org, or they can certainly give us a call. The office here in Ithaca is 272-4098.
Well, I have been speaking with John Berry, the Executive Director of the Southern Tier AIDS program, about the needle exchange program that staff offers in Broome and Tompkins counties. John, thank you so much for coming by.
My pleasure. Thank you.